welcome back. I am Dr. Ava Brooks. If you watched my last video, you know that we covered the first 4 signs of pregnancy that every woman should never ignore. Breast changes that feel dramatically different from PMS. A bone-deep, overwhelming fatigue that no amount of sleep seems to fix. The subtle nausea and bizarre smell sensitivities that can begin days before a missed period. And the implantation bleeding that is so frequently mistaken for a light, early period. Those 4 signs resonated with so many of you. My comment section filled with women sharing their stories of knowing before they knew, of bodies that whispered the truth weeks before any test confirmed it, of intuition that turned out to be right all along. But here's the thing. Those 4 signs are not the whole story. The female body has more to say, and pregnancy speaks in many dialects. Some of you wrote to me saying, I did not have any of those symptoms. I had something else entirely. Something I did not even know was a pregnancy sign. Something I dismissed because nobody had ever told me it mattered. And that is why we are here today. Because knowledge is not just power. It is peace of mind. It is the ability to trust yourself. It is the difference between weeks of confusion and the clarity of understanding what your body is trying to tell you. So today, I want to give you 4 more early pregnancy signs. Signs that are just as real, just as common, and just as frequently overlooked as the ones we have already discussed. By the end of this video, you will have a much more complete picture of what early pregnancy can feel like, not just from a textbook, but from the lived experience of thousands of women and from decades of clinical practice. Let us begin with sign number 5. Frequent urination. Now, I know what you might be thinking. Is that not something that happens later, when the baby is big enough to press on your bladder? Yes, it is. But it also happens much, much earlier. Sometimes within the first few weeks. Sometimes before you even miss your period. And the reason has nothing to do with physical pressure from the uterus. It is hormonal. Here is what is happening inside your body. Within days of conception, your blood volume begins to increase. By the end of pregnancy, your blood volume will have expanded by nearly 50%. But the process starts immediately. More blood means more fluid being processed by your kidneys. More fluid means more urine. The pregnancy hormone HCG, human chorionic gonadotropin, also increases blood flow to the pelvic region and the kidneys, further boosting urine production. And progesterone, which rises rapidly in early pregnancy, relaxes smooth muscle tissue, including the bladder, making it more sensitive and less able to hold its usual volume. The result is something that many women describe to me with a kind of bewildered frustration. They find themselves getting up in the middle of the night to pee. They are not drinking more water. They are not sick. And yet, suddenly, their bladder seems to have shrunk to half its size. They cannot make it through a movie. They cannot sit through a meeting. They are constantly aware of a low-level need to urinate, even when they just went 15 minutes ago. Now, frequent urination can have other causes. Urinary tract infections, diabetes, overactive bladder, drinking too much caffeine or alcohol. But in the context of other early signs, fatigue, breast tenderness, missed period, it becomes a meaningful signal. Especially if it is new. Especially if it persists. Especially if it is waking you up at night when you have always been someone who sleeps straight through. I remember a patient. Let me call her Emily. Emily was 27, a graphic designer, and she came to see me because she thought she had a bladder infection. She was running to the bathroom constantly. She was getting up twice a night, which she had never done before. She had no burning, no pain, no fever, none of the classic UTI symptoms, but she was convinced something was wrong with her bladder. I asked her some routine questions. Any other changes lately? She thought for a moment. She had been unusually tired, she said. Falling asleep on the couch at 8:30. And her breasts had been tender, but she assumed her period was coming. Her period was due in a few days, so she had not thought much of it. I asked her, Emily, is there any chance you could be pregnant? She laughed. We use protection, she said. Every time. I said, I hear you. But let us rule it out because what you are describing fits the picture of very early pregnancy. The pregnancy test was positive. Her frequent urination was not a bladder infection. It was her body adapting to the growing life inside her. This is why I want you to know about frequent urination. It is easy to dismiss. Easy to attribute to too much coffee, Too much water, a small bladder, a random quirk of aging. But when it appears alongside other changes, it is a clue. Your body is not randomly malfunctioning. It is responding to a profound hormonal shift. Pay attention. Now, let us move to sign number 6. And this is one that I think does not get nearly enough attention, partly because it is uncomfortable to talk about, and partly because it so perfectly mimics something else entirely. Bloating, constipation, and digestive changes. Progesterone is one of the key hormones of early pregnancy. It is essential. It relaxes the uterine muscle to prevent premature contractions. It supports the growth of the uterine lining. It helps maintain the pregnancy. But progesterone does not only affect the uterus. It affects smooth muscle throughout the body, including the smooth muscle of your digestive tract. When progesterone relaxes the intestines, everything slows down. Food moves through your system more gradually. Gas builds up. Water is absorbed from the stool, making it harder and drier. The result is a constellation of digestive symptoms that can begin astonishingly early, sometimes within the first few weeks. Women describe it to me as feeling bloated, gassy, uncomfortable. Their pants feel tight even though they have not gained weight. They feel full after eating very little. They are constipated in a way that is new and persistent. Nothing seems to move the way it normally does. And here is the frustrating part. These symptoms are almost identical to what many women experience right before their period. Progesterone rises in the second half of every menstrual cycle, which is why premenstrual bloating and constipation are common. So, how do you tell the difference? 2 things: persistence and severity. Premenstrual bloating typically resolves or significantly lessens once your period starts. Pregnancy bloating does not. It persists. It might even get worse. And the severity is often different. Women tell me the bloating in early pregnancy feels more intense, more uncomfortable, more unlike their usual premenstrual experience. Let me tell you about a patient, Rebecca. Rebecca was 31, a lawyer, and she came in because she was genuinely concerned about her digestive health. She had been bloated for 2 weeks straight. Her clothes were not fitting. She felt gassy and uncomfortable all the time. She was constipated despite drinking plenty of water and eating fiber, which normally kept her very regular. She was convinced she had developed irritable bowel syndrome or some kind of food intolerance. She had already started eliminating foods, dairy, gluten, beans, trying to figure out the trigger. Nothing helped that I asked her about her cycle. She was on birth control pills, so her periods were very predictable. She was not due for another week. There was no reason to think about pregnancy. But I have learned over the years that birth control is not 100% effective, and I never assume. I asked her to take a pregnancy test before we started an extensive gastrointestinal workup. She was skeptical but agreed. The test was positive. She was just over 4 weeks pregnant. The bloating and constipation that she had been trying to fix with dietary changes was actually an early pregnancy symptom. Her digestive system was not broken. It was slowing down to support the pregnancy. That is exactly what it was supposed to do. This is why I want you to understand digestive changes. Because they're so easy to misattribute. You think you ate something bad. You think you need more probiotics. You think you are just stressed and your stomach is acting up. But if the bloating and constipation are new, persistent, and accompanied by any other signs, do not just reach for the fiber supplements. Consider the possibility that your digestive system is not sick. It is pregnant. Now, let us move to sign number 7. And this is a big one. It is also one of the most emotionally challenging early signs because it can make you feel like you are losing your mind. Mood swings. Emotional HCG rises exponentially. These hormones do not just affect your body. They affect your brain. They affect your neurotransmitter systems. They affect how you process emotions, how you respond to stress, how you relate to the people around you. Women describe this to me in remarkably consistent language. They say they feel raw, like their emotional skin has been peeled back and everything is hitting them harder than usual. A commercial on television makes them cry. A small disagreement with their partner sends them into a spiral. They are irritable over things that would normally roll off their back. They snap at their children or their coworkers and then feel terrible about it. They feel anxious or sad or just deeply, inexplicably emotional without being able to identify why, and the confusion this creates is compounded by the fact that premenstrual mood changes are also common. Many women experience emotional sensitivity in the days before their period. The difference, again, is often persistence and intensity. Premenstrual mood changes are typically limited to a few days and resolve with the onset of menstruation. Early pregnancy mood changes can begin before the missed period and continue, sometimes intensifying over the following weeks. They do not go away when you expect your period to arrive. They linger. They deepen. For some women, these mood changes are dramatic and impossible to ignore. For others, they are subtle. A quiet sense of being off. A feeling of heightened sensitivity that they cannot quite explain. They might say to a friend, "I do not know what is wrong with me lately. I am just so emotional." And because they have no reason to suspect pregnancy, they attribute it to stress or burnout or just a rough patch. Let me tell you about a patient.
Sophie.
Sophie was 24 in graduate school, and she came to see me because she thought she was having a mental health crisis. She had been crying every day for a week. She was snapping at her boyfriend over nothing. She felt overwhelmed by her coursework in a way that felt disproportionate. She told me she was worried she was becoming depressed. She had no history of depression. Nothing tragic had happened. She just felt, in her words, completely emotionally unstable. I asked her a careful series of questions. When did this start? About 10 days ago. Is it getting better or worse?
Worse.
Any physical symptoms?
She thought about it.
She had been really tired, but she assumed that was from the emotional exhaustion. Her breasts had been a little sore. She had felt slightly queasy in the mornings, but attributed it to anxiety. I asked about her period. She was a few days late, but her cycles had always been a little irregular, so she had not thought much of it. I asked her to take a pregnancy test before we discussed mental health treatment options. She was pregnant. Her emotional instability was not a psychiatric crisis. It was her brain adapting to the hormonal environment of early pregnancy. She was not losing her mind. She was pregnant. I want to be very clear about something. Mood changes in early pregnancy are real. They are physiological. They are not weakness. They are not a character flaw. They are your brain responding to a fundamental shift in your body's chemistry. And if you're feeling this way, especially if it is new, especially if it is intense, especially if it is accompanied by other physical symptoms, do not just assume you are falling apart. You might be pregnant. And even if you are not, mood changes that are severe or persistent deserve attention, not dismissal.
Talk to your doctor.
Take care of your mental health. But also, please, consider the possibility that what you are feeling might have a biological cause that is actually a sign of something wonderful. Now, let us talk about sign number 8. And this is a sign that surprises many women because they have never heard it mentioned. Dizziness, lightheadedness, and changes in blood pressure. Here is what happens in early pregnancy. Your cardiovascular system undergoes massive changes, and it starts almost immediately. Your blood vessels dilate. Your blood pressure drops, sometimes significantly, because progesterone relaxes the walls of your blood vessels. At the same time, your blood volume is increasing, but the blood vessel dilation happens faster than the volume expansion can compensate for. The result is that many women in the first few weeks of pregnancy experience episodes of dizziness, lightheadedness, or feeling faint. This can happen when you stand up too quickly. It can happen when you have been standing for a long time. It can happen when you are hungry or when your blood sugar dips because your metabolism is speeding up. Some women describe it as a head rush, a swimming sensation, a feeling like the room is tilting. Others describe it as a persistent low-level dizziness that sits in the background of their day, like they're slightly off balance all the time. Low blood sugar also plays a role. Pregnancy increases your metabolic rate. Your body is burning through energy faster than before, and if you go too long without eating, your blood sugar can drop, triggering shakiness, weakness, and dizziness. This is why many women in early pregnancy find they need to eat more frequently, small, regular meals or snacks throughout the day, to keep their blood sugar stable. Now, dizziness can have many causes. Dehydration, anemia, low blood pressure from other causes, inner ear problems, anxiety. It is not automatically a pregnancy sign, and you should not jump to that conclusion every time you feel lightheaded. But in the context of other early signs, fatigue, breast tenderness, nausea, frequent urination, it becomes part of a larger picture. And it is a symptom that many women do not realize can appear so early. I remember a patient. Let me call her Olivia. Olivia was 35, a nurse, and she came in because she had nearly fainted twice in the past week. Once while getting out of bed, once while standing in line at the grocery store. She was a nurse, so she understood the potential seriousness of syncope. She was worried about her heart, about neurological problems, about 100 different serious conditions. She had checked her own blood pressure and found it was unusually low for her. She normally ran slightly high, and now she was borderline hypotensive. She was genuinely scared that I asked my routine questions. Any other changes? Well, she had been a little nauseous, but she assumed that was related to the dizziness. More tired than usual? Yes, but she worked long shifts, so tired was her baseline. Any breast changes?
She paused.
Actually, yes. They had been unusually sore. But she was due for her period in a few days, so again, she dismissed it. I asked her, Olivia, given everything you are describing, would you be willing to take a pregnancy test before we go down the cardiac workup path? She looked at me for a long moment. Then she said, I guess it is possible. The test was positive. Her low blood pressure and dizziness were not a sign of heart disease. They were a sign of early pregnancy. Her cardiovascular system was not failing. It was adapting. This is why I want you to know about dizziness and blood pressure changes. Because if you do not know that this can be an early pregnancy sign, it can be genuinely frightening. You can convince yourself that something is seriously wrong, and to be fair, dizziness should always be evaluated by a doctor, because some causes are serious. But before you panic, before you assume the worst, consider the possibility that your body is simply doing what a pregnant body does.
Adapting.
Shifting. Creating the conditions for new life. Now, I have described 4 more signs. Frequent urination, bloating and digestive changes, mood swings and emotional sensitivity, dizziness and blood pressure changes. Together with the 4 signs from our last video, breast changes, fatigue, nausea and smell sensitivity, and implantation bleeding, you now have a fairly comprehensive picture of what early pregnancy can feel like. But I want to pause here and say something important. I have given you 8 signs in total across these 2 videos. You will not experience all of them. You may only experience 1 or 2. You may experience symptoms I have not mentioned. Every pregnancy is different, and every woman's body responds uniquely to the hormonal shifts of early pregnancy. Some women know they are pregnant almost immediately. Others have no idea until their period is significantly late or until they take a test for some other reason entirely. Both experiences are normal. Both are valid. The goal of this information is not to make you obsessively monitor every twitch and tingle. It is to give you a framework for understanding what your body might be saying. It is to help you recognize patterns you might otherwise dismiss. It is to empower you with knowledge so that when something feels different, you have the vocabulary to describe it and the confidence to investigate it. I also want to mention a few additional symptoms that do not get their own full section, but that deserve your awareness. A metallic taste in the mouth, called dysgeusia, is a strange but well-documented early pregnancy symptom. Women describe it as tasting like pennies or like they have been sucking on coins. It is related to the hormonal shifts, particularly the rise in estrogen, and it can appear very early. Headaches. The increased blood volume and hormonal changes can trigger tension headaches or migraines in early pregnancy. Increased vaginal discharge. The cervix and vaginal walls produce more mucus under the influence of estrogen, and many women notice a thin, milky, mild-smelling discharge in the first weeks. Nosebleeds and nasal congestion. Increased blood flow and the swelling of mucous membranes can make your nose feel stuffy or prone to bleeding. Skin changes. Some women develop acne or a pregnancy glow or darkening of the skin in certain areas. All of these are possible. None of them are definitive on their own. But together with the major signs, they can help paint a clearer picture. That I want to take a moment now to speak directly to the women who are symptom spotting, who are deep in the 2-week wait, analyzing every sensation, Googling every twinge, hoping against hope. I see you. I know how hard this is. I know how every month You tell yourself you will not obsess this time, and then your body does something different, and you are right back in the spiral. Please be gentle with yourself. The symptoms of early pregnancy and the symptoms of approaching menstruation are maddeningly similar because they are caused by the same hormone, progesterone. It rises in the second half of every cycle. It causes breast tenderness, bloating, fatigue, mood changes, whether you are pregnant or not. This is not a cruel trick your body is playing on you. It is just biology. And it means that symptom spotting, while completely understandable, is not a reliable way to know whether you are pregnant. The only reliable ways are a test and a doctor's confirmation. If you are trying to conceive, try to hold off on testing until the day of your expected period, or at least 12 to 14 days after ovulation. Testing too early increases the chance of a false negative because HCG may not have built up to detectable levels yet. That false negative can be devastating, even though it may not mean you are not pregnant. It just means it is too early to tell. Wait if you can. Distract yourself. Lean on someone you trust. And know that whatever the result, you will get through this. I also want to acknowledge that not everyone watching this is hoping for a positive test. Some of you are watching because you are worried, because something feels different and you are afraid of what it might mean. Because pregnancy is not what you want right now, or not what you planned, or not what you feel ready for. If that is you, please know that my care for you is exactly the same as my care for the woman who is desperately hoping. You deserve information. You deserve support. You deserve compassionate, non-judgmental healthcare. Whatever your circumstances, whatever your feelings, whatever you decide, you matter. Your health matters. And you do not have to go through this alone. Now let me talk about what to actually do if you are noticing these signs. Step 1 is simple. Take a home pregnancy test. They are widely available, they are affordable, and they are reliable when used correctly. For the most accurate result, test first thing in the morning when your urine is most concentrated with HCG. Follow the instructions carefully. If the test is positive, call your doctor to schedule your first prenatal appointment. If the test is negative but your period still does not arrive and your symptoms persist, test again in a few days or ask your doctor for a blood test, which can detect lower levels of HCG than urine tests can. Step 2, and this is critically important. Start taking a prenatal vitamin with at least 400 micrograms of folic acid right away. Not after your doctor's appointment. Not when you have confirmed the pregnancy, with blood work. Right away. The neural tube, which becomes the baby's brain and spinal cord, forms in the first 4 to 6 weeks of pregnancy, often before a woman even knows she is pregnant. Adequate folic acid during this window dramatically reduces the risk of neural tube defects like spina bifida. If there is any chance you might be pregnant, start the prenatal vitamin now. Step 3. Eliminate alcohol immediately. Stop smoking if you smoke. Review any medications you are taking, prescription, over-the-counter, supplements, with your doctor as soon as possible. Some common medications are not safe during pregnancy, and you may need to switch to alternatives. Do not stop prescription medications without consulting your doctor, but do flag the possibility of pregnancy so that your care can be adjusted appropriately. Step 4. Take care of yourself. Eat well. Stay hydrated. Get as much rest as you can. Listen to your body. If you are exhausted, rest. If certain foods make you nauseous, avoid them. If you need to eat smaller, more frequent meals to manage bloating or blood sugar, do that. This is not the time to push through. This is the time to be gentle with yourself. I want to end with something that I think about often. In all my years of practice, one of the things that has moved me most deeply is watching women learn to trust their bodies. We live in a culture that teaches women to doubt themselves, to doubt their pain, their instincts, their perceptions. We are told we are being dramatic, that it is all in our heads, that we should just wait and see. And so many women have internalized this. They dismiss their own experiences. They talk themselves out of seeking help. They assume that if something were really wrong, someone else would tell them, but your body is not random. It is not unreliable. It is a marvel of biological engineering that has been fine-tuned by millions of years of evolution to carry, nurture, and bring forth new life. And it speaks to you. Not always loudly, not always clearly, but it speaks. The breast tenderness, the fatigue, the nausea, the spotting, the frequent urination, the bloating, the mood changes, the dizziness. These are not random malfunctions. They are a language. And you can learn to understand it. That is what I hope these videos give you. Not just a list of symptoms to memorize, but a deeper trust in your own body. A confidence that when something feels different, it is worth paying attention. A willingness to investigate rather than dismiss. And a relationship with yourself that is grounded in curiosity, respect, and care. Pregnancy is one chapter in a much longer story, the story of your relationship with your body. And whether you're trying to conceive, wondering if you might be pregnant, or simply wanting to understand yourself better, that relationship matters. Nurture it. Invest in it. Listen to it with the same attention and compassion you would offer to someone you love. My name is Dr. Ava Brooks. I am an older woman, a physician, and someone who has spent her life helping women understand and care for their bodies. I hope this video has given you something valuable. I hope it has helped you feel a little more prepared, a little more informed, a little more connected to yourself. And I hope that the next time your body whispers, you'll be ready to listen. Take care of yourself. Trust what you feel. And I will see you in the next one.